How do they get it?
Statistics for a dog who has parvovirus are around 80% survival rates.
How do you diagnose parvo in the clinic? What we're talking about tonight and what we're going to tell everybody about is the disease of parvo. Now, everybody's heard over the last year of coronavirus, and I know that I remember drawing up coronavirus vaccines back when I was, way back. But we're going to talk about parvovirus this time. Tell us what it is. What do we look for? How does it affect dogs? Does it affect cats? Take it away.
Yeah, thank you. Parvovirus. It is. Let's just start off with this. You don't want your dog to get it. It is why we vaccinate so regularly for it. For people who are on this chat, if you have a puppy, most likely your veterinarian has recommended regular vaccinations until 16 weeks old, and then once yearly afterward. But it's a pretty nasty viral disease that can affect dogs. We can kind of talk about, parvo in cats or parvo in humans, but for kind of the general purposes, I think, of this discussion, it's really largely a canine disease. Certain breeds are a little bit more predisposed, like pit bulls, Dobermans, English Springer Spaniels, and German Shepherds. But really any domestic dog or wild can unfortunately suffer from this.
How do they get it?
It's a great question. They often get it from each other. Dogs are very social beings, and in a litter, it's a virus that can be stuck on surfaces and kennels, on toys, on themselves. So it's fecal oral or fecal nasal transmission. So if a dog is, they see their world and they experience it through their, biting things and teething and chewing, and if they ingest some fecal matter of another dog that was shedding this virus, it's very possible that they could develop symptoms associated with the disease. So that's why we can get into kind of like diagnosis and treatment options, but definitely, at least in my role as a clinical veterinarian, I see it as my job as kind of educating owners as to the importance of prevention, because it's just one of those viruses that can stick out in the environment for a really long time. I don't know if anyone actually knows exactly how long it can survive in the environment, but it's non-enveloped and very heat resistant. So, super high temperature, super cold, it may not kill this virus. And, so it could live out on surfaces or in kennels, really anywhere in the environment for a long time. And so that's why puppies are, as immune compromised as they are before their immune systems kind of fully kick in, and they have their kind of maternal antibodies from their mother in their bodies, and as that's kind of waning down and before they get protective immunity, we really need to step in and do regularly, every 3 to 4 weeks or so, vaccines until around 16 weeks old, and that generally conveys immunity. I think there has been an unfortunate, canine public health crisis since the pandemic, where a lot of different states have reported upticks in the number of parvo cases. And I think, in large part, it might boil down to just the means of communication, I think, has been strained in a lot of different systems. I'm working as a clinical vet on site. I, haven't really taken time off since the pandemic. but I know a lot of clinics have unfortunately had to, you know, they couldn't really weather the storm with, business closures, and a lot of puppies didn't necessarily, it's not their fault, but owners weren't really able to stick to the schedules that would have been advisable, and it's unfortunately, I think, led to a number of increased cases. But prevention is the key, really. Like, the statistics for a dog who has parvovirus are around 80% survival rates, which are pretty good, but it usually requires hospitalization and fluids, and that can sometimes take up to 2 weeks for a dog to recover. But yeah, I know I'm jumping around the place.
No, it's fine. What I find interesting is what I've been saying over the last year when in our own pandemic, how viruses, their job is to replicate themselves and survive and change, and they find the best way that they can. And the way with parvo, when you talk about it's transferred fecally, they're shedding the virus. Dogs love to sniff gross stuff, and poop is right up there on the list. And
Absolutely.
How parvo gives these dogs such diarrhea that the virus is saying, hey, this is my best way to spread myself to all these other poor puppies out there. Speaking of diarrhea, what should people look out for? What are some of the symptoms, the signs? What should they look for if they suspect they're... Now, is it mostly puppies, or can adult dogs get it? What can they look for to see if, well, maybe my dog has parvo, I need to call the vet?
Absolutely. So I think really any young dog, generally speaking, the kind of the demographic that we're looking at is a 6-week-old puppy to 6 months. That's kind of the general time frame that I'm kind of looking for. If the patient presents to a young puppy patient presents to me in that time frame, whether it's been vaccinated once or twice or even 3 times or not, if it's been having some vomiting, or as you mentioned, the diarrhea, that's going to be on my differential list without a doubt. And so some of the early warning signs to look for, maybe even before the diarrhea starts, would be just, it's pretty non-specific. So inappetence, why isn't my puppy eating? I've been feeding him the same food, or maybe experimenting, with maybe a gradual transition from one diet to the next, but all of a sudden, he's not eating, or he or she's been a little bit lethargic, not wanting to play as much. So those are kind of some, early warning signs. It may be nothing, but that's kind of what you start to see. So, maybe that will kind of trend into not eating, maybe not drinking, becoming a little dehydrated. If you have a rectal thermometer at home and feel comfortable taking it of your puppy, noticing a little bit of a fever, those could be some early warning signs. Kind of as we progress a little bit later through the progression of the pathogenesis of the disease, there you can have, then you start really to see vomiting, really foul smelling diarrhea. I imagine that in your experience in the hospitals in which you've worked, you've smelled the puppy diarrhea, the parvo diarrhea.
One of the questions on my list that I was given here was, does parvo have a smell? And I said emphatically, yes, it does. You know it, I know it. We would just, some poor puppy would have diarrhea, and we would go, oh yeah, that's parvo. And before we even did the test, we knew it's just that bloody diarrhea.
It's one of those, exactly. It's one of those things, like, before even doing blood work, and, noticing like a low white cell count, there's 2 specific types of white blood cells that will often go down with parvo. But before you do that, if you see a puppy and, you hear the history from the owner, they're complaining about bloody stool, and they bring you in a carrier and a towel or something, and you smell it, like, you can just diagnose based off of smell, man. I mean, it's almost like pathomnemonic, and that's got to be it.
Absolutely.
And I don't know how to explain like why that is, but it's pretty
I think it may just be the blood in the stool. I'm not sure. It's something about
yeah,
and you see a puppy that's flopped out. It's not being a puppy, and it's not eating. It's got bloody diarrhea. 9 times out of 10, I would say it's
But even like I'm thinking of other hematochezia where you get blood in the stool, like giardia. There's something about parvovirus that you can just tell from the smell.
Well, besides the smell, besides the gifts that God gave you, how do you diagnose parvo in the clinic?
Sure. So there really the two main ways to go about that would be via so like how nowadays when I don't know if you've gotten COVID tested a couple times.
Wife, I have once. My wife actually, I'm actually getting over it right now.
My gosh.
My wife got diagnosed 2 days after Christmas and had a little bit of a fever. She was sick for about 24 hours. I've been sick for about 2.5 weeks. But I'm finally lively again and happy. But it was a rough about 10 days of fever and stuff like that. So I've had some COVID testing.
I had no idea, Mike. I'm so sorry. My heart goes out to you. I thought maybe just like testing just to make sure, but I'm glad that you're on the up. And
thanks, I appreciate it.
Yeah, unfortunately, like two of my coworkers came down with it in the last few weeks, and we're just we're all getting tested and thankfully asymptomatic, and so far all of the other otherwise we've all been negative, but
I wish I was.
So like those tests are kind of like the viral PCR. So they're going to be replicating, and so doing that way, or there's like a fecal antigen. So just using the stool, and a lot of clinics have the SNAP tests where you can kind of find out an answer within a couple minutes, really. And really, those are like the two ways of diagnosis. That being said, once you determine that why is my puppy having these symptoms, and we have a definitive diagnosis, additional diagnostics are still very important, and I would highly recommend baseline blood work, like doing the complete blood count and chemistry profile, because we're specifically wanting to look at these. There's usually a pretty moderate to severe leukopenia. So leukocytes are the white blood cells that are, going all around our bloodstream. And what parvovirus does is it attacks with ferocity these, rapidly dividing cells in our body. And so some of those areas include the intestinal lining. And so as it's destroying the, it's called CRYPTS, CRYPTS. Intestines, and it causes necrosis and like kind of cell death of those crypts. In vet school, it was like the Bloods versus the Crips, and that's a little differently, but we always made fun of that. But when those crypts died, that's where we have all this bleeding, the GI bleeding, the disgusting foul-smelling diarrhea. That's one area, but then it also goes after the bone marrow, and so often you'll see the white blood cell count going down. And so I would definitely advise, for puppies who get diagnosed with it, and they're in the clinic, because I would imagine most vets like myself are going to recommend that the puppy be hospitalized for IV fluid therapy and everything, but you're going to want to find out what is the initial parameter of these white cells. Could there be an anemia or anything else going on? Usually there's electrolyte abnormalities too, just because of all the fluid loss. And so that's something to definitely monitor very importantly over the course of treatment. So that's one of the big things.